Good afternoon, Mr. Spina. It's great to
Hi.
see you again.
Thanks, appreciate it.
So, the last time I saw you, a couple weeks ago, we were talking about you were having some issues with anxiety and some things like that. And I just was wondering how things have been going for the last couple of weeks.
I mean, pretty good, but there's been a few issues, just some stressors, and that just kind of got me overwhelmed, and it just made me feel kind of like, just anxious and just like I just can't deal with this. I just can't deal with it. But I got through it, but took some doing.
Okay, so you mentioned stressors. So, can you expound on that a little bit for me?
Sure. Just work. A lot of things going on, and I do handyman stuff, and one of the jobs I was doing it was just more than I expected, and just has a couple of complications and issues, and you've got a schedule, and you're trying to get done and move on to something else. You've got an appointment to set, and it's just like, why do these things always go wrong? Why do these things always go wrong? And so I had a little bit of that, and then we had a birthday party at my house for my daughter, and my wife, she was kind of running around with like a chicken with the head cut off, and I had a lot of stuff to do, get the yard cleaned up, cut the grass, everything, and it just kind of, like got to me. So, but even though I got through it and stuff, those were pretty stressful moments.
I see. So, how would you say that this anxiety and stress kind of affected you? How did it affect your behavior?
Well, when I get that way and I get anxious and feel like I'm behind or something, I kind of start getting angry in a sense where I just feel like everything's like, come on, and I get a little angry, a little bit impatient, and kind of like just, in a big hurry, throw some stuff around instead of taking my time, just, and just trying to push myself to get done with something, or, just so.
Okay. So you feel a lot of pressure.
Pressure.
Mm-hmm. Okay. So that you mentioned that you throw things around. So what is that like?
What I mean by that is like, not like throw things out of anger and all, but just like if stuff's in my way, if I'm trying to get, I just push it out of the way instead of like sometimes just being patient and picking it up and moving it, just kind of kick it out of my way, move it, just, like I'll be doing something and maybe there's a garbage can or something next to me, and I'm like, what the heck is this thing doing here? Just get this out, and I'll push it out of the way because I'm like, because it just feels like it's in the way, and just kind of like, I get frustrated with clutter and things, and so I just kind of like, kick it out of the way, but not like throw it across the room or anything like that.
Okay. And so in the last 2 weeks, since I saw you the last time, how many times would you say that you had this overwhelming feelings and this anxiety?
Probably 3 or 4 times, maybe.
3 or 4 times
Like
during the 2-week period?
Yeah.
Okay. And again, when you have those feelings, how does that affect you emotionally? Like, what are you, I know obviously feeling anxiety and stress, but what are you thinking internally? Like, what are you saying to yourself? And what are your emotions like during those times?
Well, I'm really at the point, where I'm like, I just don't want to do this kind of work anymore. And I've been doing it for years, and I have some other prospects, and sometimes I just feel done with this. I'm tired of it, and I'm worn out, and I guess the feeling is like, what am I doing here? Why am I still wrestling and fighting with these things? Why am I cutting my hands and hitting my head, or why am I scrambling, and things are like the other day I was working on some plumbing, and the water was leaking, and couldn't get the leak to stop. I had to go to the store, get some new parts, come back, and I'm just like, I just feel like it's just overwhelming, and so I guess really it's just the feelings I get of like, I'm just done. I want to just do something else, but that's not fit.
And then also, when you're having these feelings, so we talked about how you feel emotionally about them. How do you feel? How does it make you feel physically? Do you have pain? Does your heart race? Like how?
Yeah, I could say probably. It gets my heart rate up a little bit, and I'm sure my blood pressure, but I don't get a headache or anything like that. But it just kind of makes me feel physically like kind of not disoriented, but like just like clumsy. Because I'm in a hurry and I just feel, something like that, I guess. But it's hard to explain. But yeah.
Okay. Well, I'm glad that you came in today, and I wanted to see if we could work together to set some goals to work on during our sessions here. And I know you had mentioned when you were here the last time that you are taking a low dose of medication. I believe it was Zoloft. Is that correct?
Correct.
And it's at the lowest amount of milligrams, right? The 25.
Yes.
Okay, wonderful. And but you had mentioned to me at the time that you weren't really taking it as prescribed, exactly as prescribed. So can you speak to me a little bit about that?
Yeah. So I've been on it for almost a little over a couple years, and I did some research and stuff, and usually for like OCD, because I'm kind of OCD and stuff, and some anxiety, they prescribe it for about 1.5 years to 2 years or so, and I've been past that, and I've just been feeling, I said, I'm just gonna back off a little bit, just kind of wean off of it, and because I believe that, when I've been taking it, it was a time when I was so stressed, I didn't know what to do to control it and things. I really feel now like that the medicine helped me get through that. And now when I'm feeling these stressors and things, I'm able to think about it and say, okay, well, do some breathing exercises and different things that have been working. And so I'm still taking the medicine, but just not every day, but maybe every third day, because I know that it's accumulative in your system. It doesn't just all go out at one time. So there's always a little bit there. And I've just been kind of seeing, if I take it regularly, as I was weaning off, that I feel like I was feeling differently. And if I was feeling a little stressed, I'm like, okay, is it because I'm not taking my medicine? But then an hour later or so, I'll feel really good, and then I realize, okay, well, it's, just in that moment, some of those things will pass. And so, I've just been trying to see, if it's necessary or
Okay.
I haven't asked the doctor to help me do it or anything like that. But
Okay. So I just want to go back for just a quick second. So you mentioned OCD. Have you been diagnosed with OCD?
Well, Zoloft is for some of that, and I know that I haven't been diagnosed, but I know personally myself that things bother me. I'll see things out of place, and I'm just like, that has to be back in place, you know, or
Okay.
you know, like straighten things up. Not as much anymore. So you know, I know that I had a little bit of the OCD, and sometimes that's a real stressor because I used to be very stressed when I would come home or be doing a job or something, and everything was out of place. If things didn't have an order, if things were kind of messy, you know, everything just kind of stood out to me. If there was a mess on the table, it just stood out to me. Everything stood out to me,
Okay.
and so I knew I had some OCD.
So maybe, so you believe that you have some OCD tendencies, but you haven't actually
Yeah, I've never
gone,
been diagnosed.
you've
or
ever been
anything.
diagnosed. Okay, okay. So one of the goals that I would like to um, to ask you to, if we can, you know, work together on, is for you to go back to the doctor and have a conversation with him or her about your medication and just letting them know that, you know, this is what you want to do, that you want to wean off of it, and ask them the best way, clinical way that they know of for you to wean off of those, rather than, you know, just maybe, you know, trying to do it yourself or whatever. And then kind of going along with that, a couple of things that I would like for you to do is, of course, to make the appointment to see your doctor within about 2 weeks. You think you could make an appointment to see your doctor within 2 weeks?
I'm not gonna do that. I'm just not gonna do it. I'm not a doctor kind of guy, so
Okay.
I think if I feel like I get to the point where something's really, you know, if I wean off and I feel like, you know, I still have enough, maybe I could start the process back again, see how that makes me feel, or go see the doctor again, but I probably won't do that.
Okay. All right. Well, and that's, you know, that's fine. One thing that I would like for you to do is to go ahead and plan on making some, taking some notes. How are you with journaling? Do you like to journal?
No, I don't really like to journal. You know, most of the time I do have it on my phone, a take notes app,
Oh,
and if things pop up, that I need to remember or something, a good idea, I'll take some notes. So I don't really journal, but if there's something that you want me to be aware of that comes to mind, I can jot it down, but I
okay.
don't usually sit and journal.
Okay. Well, yeah, so what I was gonna ask you to do is to just take note every time you have one of those situations that like in one of those stressful situations that we talked about a little while ago, and just kind of take note of it when you're feeling anxious. I believe that you told me that you went to counseling before, right?
I
And
did, yes, sir. Yeah.
and I think you told me that your counselor then had worked with you a little bit on some breathing exercises, or you learned some techniques, some breathing
Yeah.
techniques. So, what I was kind of thinking that you might do is maybe, you know, when you get into those situations, go ahead and, you know, maybe do a breathing exercise.
That's what I've been doing. I've been I watched a guy on he's on YouTube. He's a counselor, and I also with my counselor taught him, but
Mm-hmm.
some breathing techniques,
Mm-hmm.
deep breath, and then an extra breath, and
Okay.
also there's some resetting your vagus nerve
Mm-hmm.
exercises that you can, like rubbing your ears and different things
Mm-hmm.
that really tend to work. And of course, also a big thing for me is getting some exercise, going for a bike ride. If things are, I like to ride my bike, and I go to the gym a couple of times a week, but really riding my bicycle, getting out and just getting fresh air, riding through nature, not real stressful. It just helps me to relax, and I like to play some Christian music and also spend some time, like I did tonight, I rode my bicycle and just spend some prayer time.
Okay.
And it really, if I'm really stressed and I do that, it helps really relieve that, you know. I'm looking for alternatives besides just medication.
Right, sure.
Yeah, I believe that if medication can truly fix you, then the pharmaceutical companies would be out of business. So I don't always trust, I know medication does help, but I think there's also other means that breathing techniques and different things.
Yeah, I mean, I totally agree with what you're saying. My concern is, you know, physically with you,
Sure.
you know, changing the medication dosage yourself and things. You know, that's my concern, and that's the reason why, you know,
Sure, I
I put to
understand
you
that.
to go back to your doctor, but,
I understand that. Yeah, I'll
You know.
consider that, but honestly, you know, there's so much research and stuff you can do online. It's
Mhm.
almost like you go there, and you pay them for them to tell you what you just read.
right, okay, I understand. Yeah, so, okay, so I think that's perfect. So I see that you are, you know, an outdoorsy kind of person. You said you like to ride your bike, get some fresh air and be in nature, and that those things seem to help you,
Yeah.
to relieve stress. So what I would like for you to do is, like I said, write down, just jot down the who, what, where, when, and why when you feel anxious. Okay, just trying to pinpoint possibly some patterns of stressors and things like that. Okay, and then the other thing that I would like for you to track, and there's some really cool I can't speak, habit trackers that you can use, that you can just download on your phone, like an app, and so I, you know, would like for you to either do that, or I mean, you can just jot it down
Sure.
also in your phone as well. But some of your habits, some of your daily habits, like your sleep quality.
Yeah.
And you know, if you have a Fitbit, you could use a Fitbit or an Apple Watch, like to, you know, to track your sleep, and just basically just trying to get a better understanding of your physically what happens to you when you feel stressed, like, and just again trying to identify some patterns
Sure.
and things like that. So would you be open to that?
Yeah, absolutely.
All right, wonderful. How about barriers in treatment, or barriers to reaching these goals, or completing these goals? Any barriers for you?
Into reaching these goals.
Yeah, like you obviously have willingness, right?
Yeah.
How about scheduling, or
You know, I don't really think there's any. If it's really something I want to do, you know, there won't be any barriers. I think sometimes barriers are just excuses, but I don't have any. I used to, but I don't have any excuses. You know, like going to the doctor. You know, it's not even, to be honest with you, you know, the doctor hasn't even checked in with me, you know what I mean, stuff like that. So I know we're supposed to check in with them, but, you know, I don't think, you know, just based on what I read and all that, but, you know, I think sometimes if there are barriers, it's really, you know, I'm the kind of guy that sometimes thinks a lot of stuff is just unnecessary, and so I just got to make sure that I, you know, I want to make sure I'm not skipping out on something I really need because of I think it's stupid or something. You know what I mean, so I think the barrier might be just my own willingness sometimes to go, even though I am willing, but to a point sometimes, I guess.
okay. That's great. So, what are some things that you feel that help you feel supported? Excuse me.
Supported?
Yeah, like that help you to feel heard, or you know.
You know, I used to go to a Celebrate Recovery kind of a counseling group, and I haven't done that in a while. So right now, I don't really have an outlet to be heard. Sometimes I'll tell my wife a little bit. You know, I try to talk to her, but sometimes she's like, "Yeah, I know. I don't talk about it all the time." And sometimes maybe I try to use her as an outlet,
Mm.
but you know, it's not the same. So I think that I have to. I think go back and visit a Celebrate Recovery once in a while, or maybe a counselor. Go back to my counselor a little bit. I haven't done that for a while, or just to talk to somebody. You know what I mean?
Mm-hmm.
And it seems kind of weird, but it's not like I've been kind of hesitant because I don't really have anything to say. Like there's been problems, but it's almost like I just need somebody to listen to me complain or something. You know what I mean? Just or something like not complain, but just kind of like air out the things that are going on.
Yeah, it's always good to have an outlet to be able to talk with somebody to process through some of the things that you're thinking about. You know, bounce ideas off of and things like that.
Right.
What about the support system? I think we talked briefly about that last week.
I don't remember what we said, but I mean, I do have like people like I can talk to my friend Carl or my pastor, and I guess really it's really up to me to reach out to them. But I don't have any support system, a regular system in place that I consistently meet with, you know, every other week or once a month or anything like that. I think I need to, you know, get back to that, and then that way it's not just like whenever I feel like I need it, because sometimes I feel like I do, but then I'll feel okay, and then it's like, I'm good. But if something was scheduled, then I think that would be good. I think I'm going to try to do something like that.
Okay. So you think maybe scheduling a time to speak with somebody?
Yeah, I think I need to do that. Just keep that scheduled instead of like just kind of like random, you know. Because I think that even in times when I'm like, no, I'm good, I don't really need to talk to anybody, you know, just being there talking to somebody could open up some
Mhm.
things, you know.
So who do you think that you will try to schedule that with?
I think I'm gonna,
Would that be your friend Carl, possibly?
I think I'm gonna probably, I had a counselor I used to go see, his name was Dr. Herman, and I think I'm gonna go talk to him a little bit again. Only thing, you know, I do have to pay him, but it's not that much. He gives me a little bit of a discount. So just maybe, yeah.
Mm.
My friend Carl, he was from Celebrate Recovery, and he's not like a licensed counselor. You know, it's more like almost more like an accountability buddy.
I see.
But I kind of want to talk to somebody who might have some better insight if I need it. You know.
Is having to pay for therapy, is that a potential barrier to seeking assistance?
It just depends on how much, you know, maybe like once a month or something to pay $50, $60 or whatever. It's not that much.
Okay.
So not really.
Let's see. So how, in general, how are you feeling about pursuing treatment and moving forward with things?
Well, yeah, I mean, I want to do it. Like I said, I've been through some treatment and stuff, and I think it's good just to keep revisiting a little bit, you know, and I definitely want to, like I said, you know, be on the right path for treatment, and you know, that's why I'm gonna contact probably that counselor tomorrow and just kind of, yeah, I guess what I'm saying is yes, I'm willing to do it. It's good.
Right, sure. So that's good, yeah. Okay, so I think what I'd like to do is just kind of review a couple things with you,
Okay.
before we finish up today, and, let's just see. Okay, so, one of the goals that we talked about, in an effort to, potentially discover some patterns in behavior and stressors and anxiety, is that you're going to, when you have an anxious feeling, you're going to stop and do a breathing exercise, right? And then
breathing exercise, and also just kind of reevaluate things, and just really, I think sometimes I'll just have to talk to myself and say, what are you really upset about,
Okay,
and just maybe rethink some stuff and approach things differently,
okay,
and sometimes it's just a matter of taking a break and
Okay.
just getting a little something to eat or whatever,
yes. Definitely, making sure that you're hydrating and eating and things like that. Have you ever heard of HALT? HALT?
Yes.
Hungry,
Hungry, angry, lonely, tired.
Lonely, tired, right,
Yeah.
exactly. So that's always a good reminder to take with you.
Right.
Okay, and then so when you feel that way, like you said, reevaluate, maybe take a new approach, potentially take a break or eat something. And then I would really like for you to write a note, to journal about it quickly, just a couple of sentences, nothing major, or even bullet points would be perfectly fine. And then just kind of making sure that you're writing down, just like I said briefly, about who, what, when, where, why, right? So where were you? What was this kind of the situation? Even if it's just to remind you, so that when you come back, we can just kind of discuss it. How you dealt with it, and then how you felt afterwards.
I think another thing too that you mentioned is sleep. I find myself oftentimes being in the less than 7 hours of sleep range, around the 6 to 6.5, or sometimes 5.5, and it's really something that I think's takes a toll on me, because I'll get out there, I'm tired, and I don't, and I just have to get up when I really need some more rest, and that just really starts the day off in the wrong way, you know what I mean? And sometimes, so I'm gonna also look at my sleep patterns.
Okay. Yeah, definitely. So, something that we can do is to work towards increasing your amount of sleep, of course. I guess for the next couple of weeks, my thought was to kind of track some things,
Mm-hmm.
to kind of get like a better, like I said, like
Sure.
a baseline to see where we're at with things,
Sure.
and then working that way. So yeah, tracking again, like your sleep, and even like like if you get stressed and you notice, oh, I'm hungry and I need to take a break, right? Just making sure that you're jotting that down as well, putting it in your notes. And then again, at the end of the day, if you can think of it, just write those little things in your habit tracker,
Mm-hmm.
and that'll help give us a good baseline for where to go to be able to help you with the rest of that in the future.
All right, I
In the near
appreciate it.
future. All right, wonderful. Well, thank you so much. I'm glad that you came in today, and I will make an appointment then to see you in 2 weeks.
All right, thank you.
All right, wonderful. Thank you.